And I'm here to talk to you about patient expectations and the reality. Patient expectations, it seems to be a very simple topic, but it is one of the few basic things on which the doctor-patient relationship is based. It is very important. Communication is very important because in the end the patient comes to the doctor for treatment of the suffering. He does not come to say, the innermost thing is I am feeling this pain, take away my pain. And we as doctors, we understand that this is the pathology, this is the disease process. But it is very important for the patient to feel relief from this pain. After this medical profession has come under the purview of Consumer Protection Act, we've seen so many medical litigations going on. Closer to home, we've seen recently there have been so many news that the patient's relatives have roughed up the doctors, the treating doctors, after their expectations have not been met. So this communication will be able to bridge this gap, because in our country we are very fortunate to have those patients who think that doctor is my God, and all it is required is 2-3 simple words, and the patient he feels relieved from his symptoms. And in this respect, it is very important for the patient himself to initially say what I expect from you, and because the doctor might not know what the patient expects. And it is very important for the doctor also to listen and to tell him that this is what is possible in today's treatment or in today's advances, and this is what I am capable of. And this will go a long way in reducing these problems. What we must, in this case, I want to give you a very brief example. You take an example of a person who goes to a doctor for a simple ailment like back pain. The doctor gives him some tablets, and he's not relieved. The doctor is not convinced that this pain has some a disease origin, but the patient is concerned not with the disease, he's concerned with that pain which he gets every time. So the patient then goes to, he takes these medications, he's not relieved, he goes to another doctor, and then another doctor, like how Kunal mentioned doctor shopping. And this leads to a lot of mental agony, in India the patients don't have that many resources, and those valuable resources are wasted in just going from one doctor to another, when all it requires is to tell the patient that I'm not able to relieve your pain with these medications, but you want your pain relief, I'll refer you to someone, I'll tell you to hot fermentation, I'll refer you to physiotherapy. Tablets might not be able to take your pain, and the support groups may help in acceptance, that the patient will accept that this is what is my state, I have to live with it, and what the doctor can do, he's doing, and the rest is up to me. In this case, what has now come up is informed patient consent for various things. What it essentially works on is the doctor tells the patient about the various modalities of treatment, the advantages and disadvantages of all these modalities, and the patient himself chooses, weighing the pros and cons of every modality, the cost of every modality, and then he chooses. And in this case, what is important for doctors and for patients is to understand that the patient's choice is the final one, because he is suffering from it, he knows what he wants, and he knows his own situation. And if the patient himself takes a decision, there is that responsibility which emanates from the patient. He will not rough up a doctor if he knows that he has himself taken that decision, because that thinking has gone into taking that decision, his own thinking. Patient expectations. I'd like to give you a couple of examples about it. My teacher, he gave us this example. His father, he was 70-75 years old, he got a heart attack. Fortunately, they were able to resuscitate him conservatively. After 5 to 6 years, he got one more heart attack. Again, they were able to treat him with conservative measures. At this point, his son, that is my teacher, he suggested that he should undergo a procedure called coronary artery bypass. His father asked him few very simple questions, which I think every patient should think about. He asked him, this procedure you are saying, I don't understand what it is all about. You've explained, but I still don't understand. But will it reduce the number of medications I am taking? My teacher said, no, in all probability you have to take a few more medications before and after the procedure. Then he said, then the father asked him, okay, will I be able to run around? Will I be able to do all those things which I used to do when I was maybe 10 years ago, 15 years ago? He said, absolutely not. Post-operatively, you have to take some rest, and then a strict regimen of diet as well as exercise has to go into this. And then his father asked him, okay, what is this procedure? Is it like how simple or how complicated is it? So my teacher said, there is a chance, a slim chance, but a chance that you may die during the procedure. At this point, the father said, I've lived my life. I'm 70, 75. I'm satisfied. I've seen you. I've seen my grandchildren. You say that this procedure cost me 1 lakh, 1.5 lakh. I'll rather leave it to my grandchildren, and I'll be ready for the God when He takes me away. Let me live my life the way I'm living it. One more example, just to counter this, because if this was a young heart attack patient, for him, even 5 years or 6 years of increase in his lifespan is so important. He might, see his child grow up. He might be able to do all those things which he's not been able to do till now. His dreams, his aspirations might be met in just those 5-6 years. And so every patient has a very different expectation. And this is not taught to the doctors in the textbooks. It is up to the patient. Obviously, it is the job of the doctor to ask him. But it is very important for the patient to say very clearly and firmly, Doctor, this is what I am expecting. Is this realistic? Is this going to happen? In that case, I had prepared 4 questions. Will this treatment completely cure me? Will this treatment improve my quality of life, and by how much? What are the side effects of the treatment itself? And lastly, but sadly the most important in India, is cost. These 4 things have to be thought by the patient before he goes into any treatment. Obviously, he should listen to the doctor, but because in the end, the frustration, the agony, everything is going to be taken up by the patient. The doctor will come, the doctor will treat, the doctor will go away. The patient lives with the disease process, and it is very important to treat his expectations more than the disease. Sometimes it is very important to treat those expectations, and I think this is what the patient should understand and be very firm with the doctor. Thank you very much. Patient will give state his expectations, and then the doctor can provide, see, this modality might help you, this sort of information for a young patient, like bypass.
Doctor should also say the good part, the chances of the operation being successful.
What are the side effects of the treatment?
With the operation, with the procedure and everything. Instead of the discouraging and living with your expectations, sometimes as human beings we have a tendency. I'm just discussing. We have a tendency to be free every hour. And we don't want to take that extra step and be better than what we are right now, because we are scared. So that confidence should come from the doctor. Although you have these fears, but by doing this you can even be better off than what you are right now. This aspect is also there, where the confidence comes from the doctor. Instead of saying, you live with your expectations. I'm just discussing as a human being. I'm not saying to technical factors. Of course, you have so many things to think about as a doctor.
But the patient...
As patients, we need to see both sides and then get informed. Good, thanks. There are a lot of points here to be actually very thought-provoking.